This program made possible by Tom and Maury Lowe and the Alfred and Frances Ross Foundation.
Hello, I'm Fields Moseley, broadcast journalist and board member of Intermountain Therapy Animals. By now, almost everyone has heard of pet therapy, or as we like to say, animal-assisted interventions. But maybe you haven't had a chance to try it with your own patients, and you may be wondering, what would I actually do with an animal? I'm here to introduce some of the endless possibilities for utilizing animals in rehabilitation therapies. You'll see what therapy dogs can do to support your therapeutic goals as they motivate your patients to participate with greater enthusiasm. We'll take a look at 3 environments where the presence of animals has proven uniquely effective. Our first location is a school for children with multiple disabilities. Kids with severe disabilities tend to have tight muscle tone and to show tactile defensiveness. Therapy dogs have an immediate beneficial effect on children like these. Let's hear more from Rochelle Anderson from the Utah Schools for the Deaf and Blind.
They avoid touching things with their hands or their feet. And it's because their brains have a hard time making sense of sensory input. If you're blind or if you have low vision, you really do need to be using your hands to learn about your environment. When these kids are draped over the dog, they'll immediately begin to relax. A physical change has come over them. They get the rhythm of the dog's breathing. Rhythm is an important skill in being able to learn how to walk. And it's kind of a hard concept to teach. We'll try to get the kids to open up their fists and feel with the palms of their hands, and they'll loosen up. It becomes easier for them to move their arms. A lot of them will understand it when you say, oh, let's pet the dog. And being able to do something for a dog, some of these kids kind of have a lot done for them. And so it's really exciting for them to be able to do something for somebody else. They have a sense of pride because they know they're doing something really constructive. It's working on their fine motor skills, but the kids don't feel like it's working. To them, it's play. We might have a child walk a dog to a certain destination. Just even being able to hold on to a leash and walk a dog down the hall. Those are fine motor and gross motor skills. It's very motivating. It's good for children's vocabulary and oral language development.
For children who don't have the capacity to be motivated by vision or hearing, the touch of an animal can be an important sensory stimulator. Animals encourage these children to explore their own physical potential and to communicate with the world outside themselves. Now let's move to a medical environment, the Rehabilitation Center at the University of Utah Hospital. Here, the contributions of therapy animals are tailored to meet the needs and goals of each individual in each unique situation. Follow along with recreational therapist Shauna Smith-Vladimirov as she describes a series of animal interventions with her patients. While these interactions may appear routine, they are extremely effective in eliciting a high level of participation. Note the looks on the patients' faces. Their enjoyment is unmistakable.
In a hospital, you're sitting in a bed for a long time, so you have a tendency to lose your strength and endurance. So being able to stand is actually a very difficult task, and to stand for long periods of time. Standing for endurance and then be able to throw the ball and maintain good balance and safety precautions. He also broke his hip, so he was able to keep that safety precaution by just doing that touchdown weight bearing to be able to throw that ball to maintain that good balance and endurance and strength. Today with me early this morning, he was only able to stand for 4 minutes, where he was out there for at least 10 minutes today. So it's increasing strength and endurance with that good distraction. She is learning to use that one leg as both legs right now. So what she would do is to sit and stand, and that is to increase her strength in her quadriceps and endurance. It was fun for her to reach out and not think that she's actually standing. So it works wonders because she was able to stand for a lot longer too. We also had a lady walk the dog. It's really great because I think this is the first time she said, this is the first time I've ever walked a dog, and this is the longest I've ever gone, actually walking after her stroke. So she had some hemiparesis and some paralysis on that side, so it's difficult for her to walk, but it motivated her to go longer. And then we had an older man, he played tug of war, and that's good for trunk control and strengthen your abdomen so that he can be able to pull back and reach. It works on that upper extremity to strengthen that arm. And it throws him off balance, so it's nice so that he can utilize that to maintain a good balance and a good space of support. She actually injured her rotator cuff and fractured part of her shoulder. Her goal is actually to reach and be able to pull back so she has strength. She really hasn't been very motivated to do much, and so having that dog there was really a nice break so that she would actually extend herself.
People will try and do things that maybe their bodies don't have such an easy time doing, just because they're so used to treating a pet in a certain way, reaching out, hugging, petting, make use of their arms that may not be working so well. Try and talk when they're not talking so well.
Say, oh.
Okay.
Good. Nice.
Yes. Very good.
Good job, Dawn. That ability to step into home, it just feels like that brings in that comforting, peaceful, safe environment.
For a minute, people don't think quite as much about whatever medical problem it is that they're dealing with. They just focus more on the animal and not quite as much on what's going on with them. And that's kind of a nice thing because they're dealing with themselves around the clock.
They'll try things that they don't try in regular therapy, just automatically.
And the motivation next week. So when the dogs come back next week, they're ready to go. They're ready to really extend themselves.
Among the many challenges faced by patients in a hospital setting, depression is the most insidious and widespread. Time after time, we see therapy animals providing the spark, acting as the catalyst that inspires patients to rise to their challenges and be willing and eager to do the hard work required for healing. Often nothing is more successful. Now our final stop, Aspen Ridge, a transitional rehab facility where patients often stay for a month or more. Here you'll follow two patients as they work to recover from paralysis. Occupational therapist Lydia Nadeau explains her personal motivation for including a therapy dog in her sessions.
It's more fun. I always try to make therapy fun because if it's not fun, I don't want to do it. But when you bring Sugar into the mix, it's definitely fun.
It's going to be Wednesday and Sugar's coming, and I just want to see her. To me, that's one of the best parts about it, just connecting with her.
The interaction that you get with dogs, like with Sugar, it's mainly a mental thing. It's just something that I can look forward to.
Both of my patients today have difficulty with standing, decreased sensation, and decreased strength in their legs. I'll give cues to have them balance on both legs. They'll tend to want to stand on the stronger one. So I'll give cues to that because they're totally engaged with Sugar and not really paying attention to how hard they're working.
First time I brushed her, I think I fell back in the chair, and now it's just like, you stand up, you brush her, and you don't think about yourself, you think about what you're doing. When I work with Sugar, it just reminds me that I have to use both legs.
He's having to hold the brush and do the range of motion while maintaining a grasp, which is really beneficial. That's how we move. You don't just grasp something sitting still, you have to take it from one place to another.
I like the ball toss, the interaction with her.
It's beneficial for him to grasp the ball and open it up and to break up the treats also. It's a lot of fine motor manipulation as well as hand strength. They'll stand longer, they'll make movements they have never made before. They do so much more for Sugar than they do for me. They don't realize it's therapy, it's work. With Diane, this was the first time she's yet been able to feel Sugar's fur on the bottom of her feet. You don't realize how much you rely on sensation for movement and to control. And she was very nervous to rub her feet on Sugar because she couldn't tell if she was squishing her. To have her now be able to say that she can feel it and control her leg, that's huge.
I like it when she pulls me around the hop. It reminds me to watch both my feet, hold them up, keep my muscles tight. I'm a lot better at it now, too. When I got to Aspen Ridge, I could just move one toe. That's the goal. Be walking again, be normal again.
My whole progress in here has been phenomenal. One of my goals is to be back to where I can walk a few miles again and take the dogs out for a walk. When I got here, I was in a wheelchair. I could walk probably, I think it's 20 feet with a walker.
It's our nature to want to take care of that animal. If you use it therapeutically to work on standing or to put the water dish down, it's normal for that person. And so I think that is very motivating to do something that they're going to be doing at home. Today was a breakthrough. He has not untied the bandana and tied it back up. This was a first. When I asked him to do it, he was even reluctant. They'll try for sure.
Come and get it, huh? All right. I'll come and get it.
You get things that I would not have gotten on my own. The main word I can say for animal therapy is magical. Patients will do something for an animal that they will not do for me. They don't realize they're doing it. It's normal to them, but if you have an animal lover patient, they will do wondrous things.
No doubt you noticed that Diane and Sugar had their own variation on dog walking, a demonstration of how animal-assisted therapy techniques can always be adapted to meet individual goals. What you've seen here is just a glimpse into the endless possibilities that exist when an animal is included in therapy. We hope we've given you some ideas for your own therapeutic environment. Animal-assisted interventions are no longer a novelty, but a proven way to not only motivate your patients, but also to make their experience so much more palatable, even fun. Now, final thoughts from our experts.
And it just seems like a really perfect tool to be able to say, hey, did you just realize what you did? No, I had no idea. I stood for that long? You're kidding me. You're missing out if you don't participate in pet therapy because there's physical benefits, cognitive benefits, social benefits, recreational and leisure benefits too. It's just utilizing that all of what we love to do right there in that therapy.
If you find a person that responds well to animals, you'll make some great gains.
Just give it a try for maybe 6 months and see if you don't notice a difference.
Excellent advice. Studies show that animals have an almost universal positive influence on people. When therapy animal teams collaborate with you to advance your patient's goals, everyone benefits. I speak for many pet partner teams when I say we look forward to the opportunity to work with you. Thanks for watching.